How do you touch a patient in virtual reality? I'm Dr. Byam and I'm going over the basics of interacting with patients in virtual reality. Okay, before I start, in case you forget, we put the controls in 3 different locations throughout the game. And so first off, you can check your tablet. Open it up and you'll check either controls or settings to find an image that will show you how to perform certain interactions there. The second place is on the main menu. You'll see that, again, same picture there. You can look at that and it'll show you the controls. The third place is the panel on the wall, where at any time you can select it if you're on teach or train mode, and you'll be able to, from there, select which action you're trying to perform, and there will be an auditory voice telling you how to perform that action and the region where you need to perform it. Okay, now that that's out of the way, there's 2 general ways that you interact with a patient. The first is through touch, and so with touch, you're holding the controllers with your VR headset, and as you move your hands are going to go and overlap over certain areas on the patient's body. The second way that you interact with the patient is through speech. You can talk to these patients to move them. Okay, going into more detail with touch. And so if you want to interact with a certain area, you'll use your hand and you'll go over that area. Then once you're overlapping the area, you'll press either trigger or grab, depending on what you want to do. If you want to get precise in your movements, which is important in certain areas like the abdomen where there's a lot of interaction points, then that little dot at the end of your fingertip, that red dot is like the cursor or the crosshairs, whatever analogy you want to use for exactly where you're interacting. Because it could be really frustrating. I remember before this, the reason we put that red dot there is because I would get really upset while trying to do an abdominal exam. Now, how do you know if it's a grip or a trigger? First of all, again, you can go back to those pictures and just check. But generally, we use trigger, that's the one on the front, for things that are more precise. Think of it like pinching for trigger, if I'm going to feel a pulse as an example. Then for more crude or larger movements, use the middle finger here on the grab button because you're grabbing something. It's more like your whole hand is being used. So as an example, you use the grab button if you're trying to palpate a joint, or if you're trying to grab your stethoscope to use it, or the blood pressure cuff. Now, what feedback do you have as you're interacting to make sure that you've done things correctly, especially while you're learning in the beginning? If you look up on the board, you can see that when you perform an action, it will be checked off on that board. You'll be able to see that in teach and train mode. In test mode, the interactions are purposefully hidden because you're experienced at that point. We don't want you to be able to recognize. We want you to perform an active recall. And so in that situation, you'll see the percentage rise in the top right corner, knowing that you've completed the task. The next thing I'll go over are two-handed interactions. And so lots of tasks that you'll perform in medicine are two-handed. And so for example, with percussion, that's a common one. I am going to place my hand on the back of the patient. That's a crude movement. And so I'm going to use my middle finger, the grab button over that area. And then with my other hand, I'll use the trigger over that area. Now that's a precise movement where you're tapping your finger there. And you can see I start tapping. As I alluded to earlier, you can speak with these patients. And so you can talk with them to change in histories, you can talk with them and ask them questions to find out about why they've come in. But in a physical exam, which is what we're talking a little bit more about, in that situation, you can ask them to move and change positions so that you can appropriately assess a patient. For example, when performing a cardiovascular exam, it's standard procedure for the patient to be reclined at 45 degrees. So sticking with this example, I use my hand on the button. You can use trigger or grab. So then I'm changing the position of the bed. Now I'll use another example. I'm going to do a Shamroff's window test. So I'm going to ask, can you put your fingers together like this in a window test? And you see John does it. Now, how do I get John back to normal? You do that with saying relax. If you say relax, John will go back to the default position that he was in before that. So it should be something you're saying quite often throughout the exam. Now, if you don't feel comfortable having your mic activated while you're doing these skills and you don't really care about the convenience of that, then you can use your tablet to change the patient's position. So if you open up the tablet, you'll see patient position section. Now, there's a lot, but we've tried to break down the categories simple enough so you can very rapidly get to where you need. Now, if you're having troubles with your speech, trying to find the right thing to say to make John do what you need him to do during the exam, don't worry, we're working on upgrading our speech. But to help with that, inside of your tablet, you'll see that for each of the interactions, below it is written the actual speech that the system's kind of looking for, the most ideal speech. It's keyword recognition right now, so if you include a few of those keywords, for example, heel, shin, right, you'll see he's doing the heel to shin test from the right side. Now, this is something that we want to be very convenient for you. So if you're having troubles with any of these interactions, watch one of our later videos on how to provide feedback on that. Meta and ourselves have tried to make it really easy to provide feedback in these VR games so that we can improve the user experience and make sure that it's as easy as possible for you to learn. Well, as easy as possible in the right ways, and still hard to learn medicine. Can't get over that. But go check out that video if you want to see how to provide better feedback. Also, join our community membership. That's the easiest way to help this application grow and improve. Anyways, thanks for watching. Best of luck with your studies.